Hi, James.
Hello.
How is it going?
Pretty good.
Okay, welcome to the office.
Thank you.
I will be taking a couple notes periodically as we complete your examination.
Right.
So I have you in for a complete neurological assessment today, is that correct?
Yes, complete neuro.
Okay. So it looks like this is a repeat assessment, and we are checking to see if there has been any changes to your neurological function and cranial health. Okay. So excuse me while I just place a pair of gloves on so that we can go ahead and get started.
All right.
It does look like we have quite a few things to test today, so because this is a repeat exam, we will be moving through them fairly quickly. You should be comfortable with everything that we are testing this evening, okay?
All right, sure I will be.
Do you have any questions for me before we get started? Do you understand why you're here?
Yes, I do.
And why these tests are necessary for you?
Yes, I do.
Okay. Just making sure. And I would also just like to obtain your verbal consent to touch your hands, your face. I will be needing to get fairly close to you at some points in the examination. You can let me know if any of that makes you uncomfortable, okay?
Okay, that's fine.
Okay. If I can just have you click and sign on the pad to give your consent. Perfect. Thank you so much. So let's go ahead and get started. And actually, I believe Serena said there was a couple of questions that I needed to go over with you. Perfect. Okay. So can you tell me what your current pain level is, if any?
Pain level is a 2.
2. And where exactly is that located?
Shoulders and back.
Shoulders. Okay. Can you describe the pain for me? Is that like a dull, achy, sharp stabbing?
It's a dull, achy.
Achy.
Just the muscles.
Muscle pain.
Lower back and like shoulders across the traps.
Lower back. Is the chair that you're sitting in currently comfortable for you? Are you okay?
It is, thank you.
Make sure before we get started with the examination. Okay. So looks like it's been just over 1.5 years since your accident.
Okay.
So we're just doing a 6-month repeat, and depending on the findings of today's examination, we'll likely see you again in another 6 months just to make sure that there are no changes.
Right.
So let's go ahead and get started. I'm sure you know what to expect by now.
Yes.
So I will start by giving you your 3 words for today.
Okay.
So let's do table, door, calendar.
Okay.
So can you repeat those for me?
Sure. Table, door, calendar.
Perfect. And we will be coming back to those.
Okay.
So Serena did get your vital signs in the lobby, and all of that was within normal limits. Your blood pressure was fine. It was better than the last time I saw you.
Good.
I do just want to recheck your temperature because she got one abnormal reading, and I wasn't sure if that was a fluke or if you were really reading high. 97.6, 97.4, 98.2. So it looks like actually she was correct. For some reason, your right temporal area is a little bit warmer. 97.5. Okay, interesting. Are you experiencing any pain or headache on this side?
No, I'm not.
Okay. All right, James. Well, as always, I will get started with a visualization of your pupillary reaction. So you can keep your glasses on today.
All right.
So if I can just have you look straight ahead for me. I'm going to be having to look inside your eyes.
Okay.
As usual, let me know if this causes you any pain or discomfort, okay?
Sure.
Just looking for any changes in your eye health. Any possible discomfort or changes in swelling. Your last couple of visits have been pretty routine, so I don't expect to see anything new this evening, but it's always good to make sure. Should you look here at my finger for me? Perfect. And here. Very good. Go ahead and look at the marker on the wall. you follow the light for me. Follow just with your eyes. Very good. So I do see an improvement in the slight delay we saw the last time you were here, which is great.
Okay.
Yeah, definite improvement here on that left side. Perfect. Okay. Very good. So I'm just going to notate that I do see an improvement. The left gaze tracking is now within normal limits. The last time you were here, it was just a little slow.
Okay.
Good. Okay. So let's go ahead and I'm going to hand you the occluder.
Okay.
And I want you to go ahead and include whichever side you would like.
Okay.
Good. Can you see my light with your left eye?
Yes, I can.
Go ahead and follow it for me. Look at my finger. And look at the light. And look at my finger. And look at the light. Perfect. Go ahead and do that on the other side as well. So can you see my light here?
Yes.
Go ahead and follow it for me. And look at my finger. And at the light. And at my finger. And at the light. Perfect. Okay. So seemingly no abnormalities there. Good. Okay. So I want you to just briefly have a look at my acuity chart here.
Okay.
Start from the bottom line. You typically don't have any issues with visual acuity, so can you read this line for me?
Yes. PEZOLCFTD.
Perfect. And if you'll occlude one side. And again.
PEZOLCFTD.
Perfect. Other side.
PEZOLCFTD.
Great. What color is this?
That's green.
In here.
That's red.
Good. So visual acuity is within normal limits. Okay. So let's go ahead and check your peripheral vision. And I think today I'm going to make it slightly more difficult for you. So let's try colors that might be a little bit harder to see. We normally do the stage one, which is the red and green.
Right.
So since you've been here a couple times, let's see if we can trick you a little bit. So can you tell me what color this is?
Yeah, mint green.
And here.
Purple.
Perfect. So you're going to tell me when it disappears and when it reappears. Okay, so testing that peripheral vision.
Okay.
So can you see this here?
Yes.
Good.
Disappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears, disappears, reappears.
Perfect. Now I want you to say green or pink, okay?
Okay. Pink, green, pink, green, pink, green.
Perfect. So tell me when you can no longer see both.
Now.
And when do they both return?
Now.
And did they return at the same time?
Pretty much, yeah.
Okay.
Reappear, same time. Reappear, reappear.
Good. Okay, so no abnormalities there. All right, James, so let's go ahead and get started kind of the nitty-gritty of the examination. Are you able to repeat your 3 words?
Sure. Table, door, calendar.
Very good. Did you find that difficult at all?
No, I didn't.
Good. All right, James, so we are going to move on to the more extensive part of your neurological assessment today. So if I can have you close your eyes for me.
Okay.
Just gonna take out a couple tools here.
Okay.
And I want want you to stick out your left hand. Maybe placing a couple objects in your hand, and I want you to try to tell me what they are. So these are a little more difficult than they were the last time.
Okay.
So this is the first object.
A roll of tape.
Good.
Paper clip. Or a binder clip.
Very good.
I don't know what it's called. Not a clothespin, but similar, just like a clip.
Okay, that works.
Paper clip.
Good.
Velcro strip.
Perfect. Okay. So no abnormalities there. You did very well. Those were significantly more difficult than the last time, and you were able to get all of them. Okay. So that's great. So the next portion of our examination is going to be some sorting. Okay. I know you love this part. Oh, yeah. So I'm just going to move our tools closer, and I do have more of a variety than I did the last time, so this is going to be more difficult for you.
Sounds great.
And let's start with the cool. Okay. So I would like you to start by picking out the larger test tubes. Okay, now of the smaller tubes, can you arrange them in order from dark blue to light green?
Sure.
Perfect. Now can you integrate the larger tubes in the same color arrangement with these? Very good. Okay, so no issues with the cold tones. So let's do the same thing with the reds. So pick out the larger tubes.
Just the reds?
Of all of the colors, please. Okay, and I will give you this one from the last set. Now, if you could arrange these in descending order, so I would like them to go from the lightest color to the darkest.
Okay.
And you can include all the sides here. Very good. Now, can you integrate all of the colors to follow this light to dark? It's a little more difficult this time. Okay, is there anything you'd like to change?
If anything, this at the end, maybe. That's really about it. These lighter purples on the left. this is darker. So yeah, that looks good.
Very good. Okay, so I'm going to move these slightly just so we have a little bit more working space here. And you integrate these as well.
Okay. And these. It's in between the purple and the red.
Okay, so that's kind of up to interpretation. I probably would have placed them after the green, but I see why you did that, so that is acceptable.
Okay.
Excuse me while I just remove
Sure.
hair. So you did very well. So this was quite a bit more extensive than the last color testing that we did, so that is great. And I will spare you me putting these away, and I'll just slide them to the side for now. Okay, so I need to just catch up here. So color testing went very well. It's going to be tricky seeing how I can make that difficult for you the next time.
Okay, I can't wait.
Okay, so the next thing I'm going to do is bring out the bands, and I have incorporated some more colors this time.
Okay.
So testing your neurological functions as well as your strength and resistance here. So let's start with the color testing. I would like you to pick out what appears to be the lightest color to you.
Okay. I would say the yellow.
Okay. What would you say is the darkest?
The darkest, I think we're gonna go with the green.
Okay.
Yeah, green over blue.
Okay. Do you see any two colors here when put together can make a different color in the sequence?
Yes. The yellow and blue can make the green. Blue and green probably make purple.
Okay.
And pink and green make brown.
Okay. Now I would like you to tell me if any of these bands appear different than the others, not in color but in texture, and if you can tell me why.
No, they don't appear to be different in texture. Yes, this one blue one is different.
Okay, what's different about it?
It does not have the ridges. It's not, there's no grip.
Perfect.
It's just smooth.
Okay. So I would like you to do a resistance test with this one band.
Okay.
So parallel to your elbows. Perfect. And now can you tell me if this one is any different?
It feels, there's more resistance to this one.
Good. Okay. So now we are going to do the strength test as normal. So I will start you with the blue.
Okay.
Good. And there are more bands in quantity here, so this might be more difficult. So
Okay.
how is that?
Sorry.
That's okay.
Difficult.
Okay. Now all the way out to your elbows if you can. It's pretty difficult.
Yes.
And then I suspect you might not be able to do it with the yellow. So we've pretty much doubled the quantity here that you were able to do the last time.
That's about it.
Okay. So you did fairly well. So it appears some of that fine motor strength has returned for you. And of course, as you get stronger and as your sessions pass, you should be able to do a little more than you were the last time. So
Yes.
very good, making progress. Now, the last thing I want to do is have you color code for me. So I would like you to place any tubes that go with these bands just in a row on top.
The tubes?
Yes, as well as here. And here. And here.
So I keep.
Mm-hmm.
So essentially, the purples would be up with the pink.
Good.
And the red as well.
Good. No place for the gray, he's just left out.
The gray is just left out.
Okay,
Yes.
that's fine. Okay, so you did very well.
Okay.
Your ability to critically think and problem solve is normal and more defined than it was the last time, so you are making strides there. Very good. Looks like you've been doing your exercises at home.
I've been trying.
Good. I'm sure our little friend would like to play with one of these if she could. Her temperament has changed since the last time I taught her. You've been working on some more training.
Yeah.
She's doing well.
She responds well to tranquilo.
Are you teaching her Spanish?
I am.
Wow. Okay, so I'm just going to catch up on a couple of notes there. So your critical thinking has definitely improved. Okay, very good. Right, James, so let's go ahead and move on here. I have a couple new things that we did not test the last time.
Okay.
So I am going to do a brief smell test, and I'm gonna have you go ahead and close your eyes.
Okay.
Now I have 3 things here that I would like to test, and the last time we did a smell test I used food items. This time these are not things that you can eat, so that is the clue that I will give you, okay?
All right. Strong vinegar smell. Am I able to smell it again?
Sure.
It's not lemon, is it?
It's not.
It almost smells citrus, but I can't really place it.
Okay.
I'm getting a little vinegar, a little citrus.
So that is tea tree.
Okay.
I could see why you would say that. It's a little earthy, that kind of earthy vinegary smell.
Okay.
Okay, so this is the next one, and the next one.
It's lavender.
It's good, okay.
Okay.
That is lavender laundry soap.
Okay.
This last one is probably the most difficult.
Okay. And it's not edible.
It's not edible, but it does have sort of a floral-y smell. Do you need a hint?
Please.
So something that you might see like on your grandma's table around the holidays. It's usually in a bowl.
Like for aromatics?
Yes.
But I can't place quite what it is.
Okay.
Sage. Not ginger. I can't place it.
Okay. Sage is accurate. It's potpourri.
Okay.
So there's a little bit of a mix of smells there.
Okay.
But you did fairly well. Those were pretty difficult, so good job. Okay. All right, let's go ahead and move on. And I believe, actually, I would like to test for your sensation, but I have a couple of tools here that we did not use the last time.
Okay.
So what I'm gonna do is have you extend one of your arms. Your sensation has been normal in both sides, so we don't need to test both sides today. So we will do this one. So I'm gonna start by testing for some neuropathy. This can be kind of an onset diagnosis, usually around this time in recovery. So I would like to see if this is something that you're maybe experiencing that you haven't yet noticed.
Okay.
So this is going to be a very distinct brushing, and I don't want to give you an example quite yet because I want the test to be accurate, but you will feel kind of a wiry brushing, and I want you to tell me if you can feel it and if you feel any like tingling or burning sensation with it as well, okay?
Sure.
So I'll start kind of at the fingertip here.
No,
Anything
no tingling
abnormal
or
there?
burning.
Okay. And if we go here.
No. No.
Okay.
No. Nope. No. No.
Good. And if you'll flip for me just for a second, I just want to make sure I'm testing correct dermatomes here.
No tingling or burning.
No, but you did feel it.
Yeah.
Okay. So go ahead and flip back over for me. We're going to repeat the same test this time.
Okay.
This is a bit of a softer brushing sensation. So this is silicone, and it covers obviously a wider surface area.
Okay.
So you should feel the sensation, but again, let me know if there's any tingling or burning, okay?
Sure. No. 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 No, no tingling or burning.
Good. And
no. Nope. No.
good. Flip over for me. Perfect. Okay. So now we will move on to just the general testing of sensory function.
Okay.
So I'll have you stretch your hand out, and we're actually going to do this kind of prone and relax. Is that comfortable for you? You have
fine.
enough support there?
Yes.
Okay. So I think actually what I'm going to do, because I do want to get an accurate testing here, is I have some therapy putty that I can use to stabilize your hand. So I think one should be sufficient. And I'm just going to use this to place underneath your hand.
Okay.
And this will help stabilize it. I don't want any other sensory components affecting the test.
Right.
So I'm going to place this underneath your hand, and if you'll just press your weight into it, you can feel that kind of anchors you a little better so that your hand is completely elevated from the table. Okay. So that gives us a little more of an accurate testing space. So I will have you close your eyes, and as always, I'm going to start with the Q-tip, okay?
Okay.
So you say yes if and when you feel it.
Yes. 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 Yes.
Good. Okay. So I have a couple new tools here that I will be using, and they are graded. So we're going to start with a level 1.
Okay.
Can you feel this? You feel this here?
Yes, I can.
Okay. So just say yes if you feel it.
Okay. Yes. 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 Yes.
Okay. So moving on to a level 2. Can you feel this here?
Yes, I can.
Okay.
Yes. 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 Yes.
So this is level 3. Can you feel this here?
Yes. Yep, feel it. Yes, I feel it. Yes. Yes. I think so, yes.
Okay.
Yes. Yes. Yes.
Okay. So moving on to a level 4. And this one is extremely difficult. So can you feel this?
Yes. 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 Yes.
Okay, you can open your eyes. Okay, so essentially I am still seeing some of that sensory loss in the fingertips.
Okay.
You were able to feel majority of the grade 1. You missed a couple here and there, but you did fairly well.
Okay.
As we moved on into the 2nd and 3rd phase, you did okay, but you did start to miss quite a few with phase 3. And then with phase 4, you weren't able to feel it at all, really. Okay. So you can feel it on the palm of your hand here,
Yeah.
but definitely not on the fingertip
Right.
there. Okay, so that is something that we will continue to test, and that's why as we move on in your sessions, we integrate new tools so that we can kind of retest those functions for you, okay?
Okay.
So good findings today. And of course, we're gonna test the sharp sensation last, which you'd never usually have issues with, so
Right.
I don't suspect to see a change here, but we will see. So I'm just gonna anchor you down here. Okay, ready?
Mm-hmm.
You feel this here?
Yes. 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 Yes.
And again, any changes as we move up?
No changes.
All feels the same. And actually, you can feel this here.
Yes.
Let me know if you no longer feel it.
No longer feel it. No longer feel it. No longer feel it. No longer feel
So again, right at about that joint line. And can you feel anything here?
it. Barely, yeah. I feel it.
Do you feel that on your fingertips?
Yes. Yes. Yes.
Okay. So you feel it if it's a continuous sensation, but if it's sporadic and you just now feel it, you don't feel anything.
Right.
Okay. That's okay. So it's likely that you're not actually feeling it, but your brain is filling that in for you since you know that it's coming, but when you're not expecting it, you're not able to feel it still. So
Yeah.
that's okay. We are still making significant progress there. So lastly, we are going to test the air sensation, and you had a little bit of difficulty with this the last time, so we'll see if any improvements have been made. Can you feel that?
Barely. Barely. I can hear it more than I can feel it.
Okay.
Barely. Barely. Yes. 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 Not so much. No. No.
So about the same as the last time. Okay. All right. Just gonna occlude the blood flow here and look at your capillary refill, see if there are any significant changes there. Appears to be about the same. Have you been working on your hand exercises?
Yes, I have.
Okay. So definitely continue with those. You do seem to have regained some function in this hand. Okay. So let's go ahead and test some of that muscle strength.
Okay.
So I want you to flip your hand for me. Squeeze my hand tight, tight, tight. Good. And this side, tight, tight, tight. So still a little bit of heavier strength on this side, but I do feel some improvement here from the last time. Can you separate your fingers for me? Good. And squeeze them tight together. Good. Okay. Let's do some reflex testing here. Good. 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 Perfect. Okay. All of that is good. And the last thing I want to do is, as usual, I would like you to use your hand to roll this into a ball. Good. So some of that fine motor skill has definitely improved. Okay. Perfect. Okay. So you did very well with that. And you've been working with your putty at home?
Yes, I have.
Okay, good. I know it gets a little redundant, but it is important to keep up with that strength. So the last thing I want to do is your least favorite. So we are testing for graphesthesia, okay? So I want you to straighten your hand out for me, flip it over. I am going to test the letters and numbers.
Okay.
Okay, so let's try lowercase letters and see how you do.
All right.
Okay.
One more time, please. D.
Okay.
C.
Good.
One more time, please. E.
Okay. So let's try uppercase.
P.
Good.
One more time. B.
Good.
A.
Close.
Must be a H there.
So this is A.
Okay.
So what is this?
H.
Close.
V. L.
Let's try a different tool.
One more time. X. I'm not sure. P.
Okay.
B.
Good.
Y.
So still having quite a bit of difficulty with that.
Yeah.
So something that we will continue to work on. So let's do, as the very last portion of your examination, the test where I have you repeat. So I am going to draw a figure in your hand and I would like you to attempt to repeat it in my hand, okay? So do it 3 times.
Okay.
And you try to repeat that in my hand. Perfect. Good. So we'll do that again. And this time it's going to be a letter.
I have no idea.
So just try to repeat the shape. So here, here.
Okay.
And what is that?
It's he.
I think you're overthinking it.
Okay.
So you had it perfectly.
Okay.
Okay. So let's try again. Okay.
A Y?
Very close. It's an X.
Okay.
But that was very close. So you did better with that.
Okay.
So I think sometimes you overthink it a little bit. You tend to mix up T, L,
Right.
A, H, X, Y. So they're very similar.
Right.
But you're kind of inverting them or flipping it. But you are making improvement there. So
Okay.
I did see some improvement today. You did very well.
Good.
So that will be it for today's session, okay? So as long as you don't have any updates or anything that I've missed.
I don't think so.
Okay, you're still keeping up with your regular therapies.
Yeah.
And you're still working on your exercises at home.
Yeah, my putty buddy.
Yes, your putty buddy. Is it still, how's the integrity doing? Do you want to take another one home today?
I can take another one.
Okay, so you can take this one home with you. Just
Okay.
I know you've been working with that one for the last few months.
Okay.
I would like to see you back in another 6 months to retest. As long as you're keeping up with all your therapies and stuff, at that point we will kind of reassess and see how frequently we need to be seeing you at that point, okay?
Okay.
All right, well, thank you so much for coming in. I hope you and Baby Cat enjoy your training at home, and I will see you in a few months.
All right, thank you so much.
Thank you.
Bye.